As a chiropractor, you can imagine I spend a lot of time dealing with people's joints. And I spend a lot of time dealing with functionality. If you need an adjustment, in almost every case, the real problem isn't that you have an alignment disorder, although you do. Your problem is that it's not getting back in line by itself. The adjustment is a motion intervention. And motion at joints brings us right to the heart of probably, I'm going to get in trouble. There are chiropractors that will probably throw rocks at me. But I'm going to say that chiropractic for nerve interference, chiropractic to enhance your body's life flow, these are essential ingredients of chiropractic philosophy. I'm not putting anything above or behind that, aside from that. Much more central to the day-to-day and in the moment experience with chiropractic is joint motion. The beauty of chiropractic is the function that it brings. Function is life. And so the functional dynamic, looking at chiropractic articulately and mechanically, isn't in no way disparaging what many other chiropractors say about chiropractic. These things dovetail together perfectly. But let's talk today about the joints, and specifically arthritis. And what I hope to say today isn't really just about chiropractic. We should understand what's happening in our joints. And if you look at a person's life across your lifespan, if you make it, and most of us will, life expectancy is in the high 70s. And so most of us will find ourselves at that place where we've retired or we're about to retire. And most of us, basically all of us, will have some degree of degeneration in our joints. At least half of us will have actually presented in a doctor's office with a disorder that gets described as arthritis. And so arthritis has several heads. As a monster with many heads. Arthritis, there are categories of arthritis that the problem with the joints is a reflection of other metabolic disorders. Things like rheumatoid arthritis, the seropositive arthritis, psoriatic arthritis, those metabolic arthritis, they're diseases that need to be managed. Medical management is necessary. Those are diseases that attack things other than your joints. The reality, however, is that that's a very small section of the people that have what we're going to call degenerative joint disease or osteoarthritis. And even people with the seropositive metabolic and immune-mediated arthritis, those are disorders that attack the joints, and those disorders need to be managed. But once the joints are attacked, as well as joints that are injured in trauma and injury, you now have an injured joint that fits exactly into the same management pattern as the osteoarthritis patient. You have a damaged joint, and so what are you going to do about it? It's important to understand that our joints have very slow metabolism. Their metabolism is basically separated from vascular supply. The joints themselves, there's no blood flowing in joints. The tissues in joints do have a respiration, and they're capable of healing, and the respiration is entirely driven by motion of the joint. And so having a joint enjoy any kind of hope for recovery or normalization, the only hope for that is if you keep that joint moving. That's carved in stone. And even the remarkably injured joint, if we can be deliberate about seeing that it's kept moving normally, your body does a wonderful thing. No one needs me to see that they heal. Every injury, every disorder heals. In most cases, these things that we call degeneration really represent a healing process that simply went wrong. If you let it sit still while it's recovering from having been insulted, a joint will heal. And it'll heal with scar tissue, and it'll heal over time with bone spurs. And the healing process will have happened. And you'll have a joint that doesn't move normally anymore. If you're able to keep, this is true for joints, for tendons, for muscles, if you're able to maintain normal functionality through the recovery process, you end up with a recovery that allows for normal function. I have people on my bench all the time, and one of the most important ingredients I need, if you're on my bench and I have any hope of getting you better, it's because you expect to get better. If I don't have that, we have very little success in here. And especially as we get on in years and we're told that you're old. You have arthritis and you're old, and so it's over for you. You should have pain. Take a pill. And you can accept that. And I will tell you that if you don't choose to accept that, if you choose to fight that, you've taken on a job. You've taken on a project. I would tell you that you, 20 years from now, will come back and thank you today if you decided that your body was supposed to work and you did the things to insist that it worked well. The divergence in the pathways are remarkable. 70 can really be the new 50, but not if you just let your body become a prison. Conceptually, it's too simple and it's too clearly true. If there's an issue with it, it's that you're a complicated machine and it requires real deliberateness. And the layers of deliberateness are getting the motion, changing the tissues favorably, and then the last layer, probably the trickiest layer, is the cerebellar layer, the organizational layer. If you're on my bench and you need to be adjusted, and your body has begun to succumb to degeneration and poor movement patterns, and there are a lot of us, you don't have to be old to be in that boat. Your cerebellum, your organization system has arrived at a new pattern where wrong is the new right. And there are many people, we could adjust every joint perfectly and heal every muscle. And in a matter of weeks, they'd be right back where they were because they learned that. And so there's adopting a physical culture of functionality and wellness that really becomes long-term success in managing with articular disorders. I hope this helps. If you have any questions, feel free to reach out to us here at Grovetown Chiropractic.